Hi, I'm Dr. DeCubelos from Main Street Chiropractic. Just want to take a minute to talk a little bit about one of the biggest things I see walking into my practice, and that's low back pain. Now, low back pain is one of the most common reasons that people go to their primary care doctors and even to the ER. So it's very, very, very likely that you've experienced it at some point in your life or you know someone that has. But low back pain is not all the same. And that's really the key to making sure that we get it treated the right way. The first thing that I always do is identify what's causing the pain. Are we talking about a disc issue? Are we talking about a bone issue? Are we talking about a nerve issue? Or is it a ligament issue or a muscle issue? This is very, very important because if you don't know which one it is and get it specifically diagnosed, you don't know if you're doing the right treatment. And if you're not doing the right treatment, you're not going to get the right kind of results. This is just going to come back, and unfortunately, this is going to become a chronic condition. Now, that's what happens a lot of times when people walk into my office. They've had issues that have been going on for many years. They've tried different treatments before, and when I ask, okay, well, what was your diagnosis? All they can tell me is low back pain. Now, low back pain is a symptom. It's not a diagnosis. Even sciatica is a symptom. It's not a diagnosis. If we have sciatica, what's putting pressure on that sciatic nerve to cause the pain that's radiating down your leg, whether it be numbness, tingling, burning, or weakness? We've got to find out what that trigger is, because if we don't know if we're doing the right treatment, and we don't know what outcomes we can expect. So that's really the first thing. After that, once you find out what the problem is, then putting together a right kind of treatment plan to identify how we can fix that problem, what our outcome measures are, and how we can make sure this is not going to come back. So the other problem I see with a lot of people when they come in, they say, Doc, you know, I've been going to physical therapy for 6 to 8 weeks. My primary care sent me there. I feel like I got maybe about 50% better, but that's it, and I'm still dealing with this pain. I don't know what to do. Well, the reason that they feel that way is, again, the problem wasn't identified, and they started doing stretching and exercising too quickly. The body wasn't moving the right way. Your biomechanics were altered because of this pain and because of this problem. So you're moving differently, and all you did by strengthening was strengthen your body to be able to compensate for the problem more than it is. So now what we have to do is we have to go back and we have to retrain the body to move the right way while fixing the issue. Then we can work on strengthening it up. So strengthening is never a good idea to do right when you have an injury happen. There's specific times for it, and it is great, and it's part of every treatment plan that I do, but it has to be done at the right time. Otherwise, we're just going to make it worse, and this is how we get to those chronic type of things. Now, the reason an issue becomes chronic is, yes, it's been there for a while, but what happens is when it's become to this chronic situation, that's when we start getting arthritis and degeneration, and we start talking about permanency. And I hate to have that conversation with people that, hey, we've got some permanency and I can't get you back to what I could have if I would have saw you a couple months before. So my best recommendation is you want to get things checked out. When you get things checked out, make sure you get a specific diagnosis. If you don't have that diagnosis, then you need to keep trying to find a doctor who can give that to you. That's what we try to do here. But even if I can't help you, I work with multiple other doctors, whether it be orthopedic surgeons, neurologists, physiatrists, even PTs. We will get you in the right place. That's my goal and my promise to all my patients, is the first thing I want to make sure that you're in the right place, because if you're not, I can help you get to the place that will help you better. So again, I'm Dr. DeCubelos. Any questions, you can give us a call, but we're always here for you too. So if you're having those issues with low back pain, we'd love to see if we can help you out.